constipation, that can bring a lot of children into the emergency room. So things like vomiting and diarrhea. Constipation can also bring a huge amount of anxiety to parents, especially of new babies. They'll bring their children in. So let's talk about a couple of points. What is constipation, and what can you do to help your child? So again, babies are going to vary from baby to baby on the number of stools they have every day. Breastfed babies are going to have more stools per day. Bottle-fed babies are going to have less stools per day. The stools are going to change depending on whether they have more formula versus breast milk. A mother who goes back to work, let's say she breastfed her baby for many months, now she's going back to work, she now gives her baby formula, the number of stools is going to go down, and a parent may think that their child is constipated. What are some clues that a child is actually constipated? What are we going to look for as practitioners and as physicians when we talk to you about your child? Well, the first is less frequent bowel moves than normal. Again, a child goes down in the number they've had per day, again, allowing for the fact that their formulas hasn't changed or they've gone from breast to bottle.
Or
that
added
would
some
be,
solids.
Right, added solid food. When you add a solid food to a child, they start eating more and more solid foods, the number of stools is going to go down. But keeping all that equal, if the number of stools has gone down or they haven't had a bowel movement for 3 days, that might be a clue that your child may be getting constipated. If the child looks like they're having any discomfort, any pain when they're trying to stool, that also may be having a clue that your child may be getting constipated. If the stool that they pass is kind of hard and dried, that would be another reason that another show that they might actually be getting constipated. And then lastly, if children are very constipated, sometimes they just get a little leakage of liquid kind of around the stool. And so if you just have a little bit of leakage of liquid coming out of the child's rectum, out of their anus, that may be a sign that they're also constipated. And generally, you don't see large amounts of stool coming with that. One thing we should mention is about the very, very young baby. So we'll see this in the ER a lot, where a parent of maybe a 3 or 4 week child will come in and say, you know what, he's turning red and he seems to grunt every time he tries to have a bowel movement. And we talk to the parent and we say, well, has anything changed? No, they're still breastfeeding normally and he's still having the same number of stools. He just seems to be doing all this stuff before he has a bowel movement. Well, remember that a child learning how to stool, this is not something we know how to do naturally.
You would think it's natural to know how to do this, but it isn't.
It isn't. You have to learn how to do this. So this poor child is kind of learning what all the feelings are down there and learning actually how to have a bowel movement. So them turning red and grunting is a very normal phenomenon for very young babies as they learn how to stool. And the last point is that we have the advantage of gravity. They're actually on their back half their life. So they're trying to stool, not with the help of gravity. So remember that just seeing a child's face turning red or them grunting a little bit as they pass a stool is not them having difficulty. It's them really learning how to have a stool. In the newborn period, exactly.
Now, is there anything you can do about a baby that's constipated? Of course there is. Now, if it's a young child, if it's a little kid, an infant, usually less than a month or 2 of age, you should call your pediatrician and have a chat with them about this, because there are certain things that your pediatrician is going to want to ask you about, specific if your child's having constipation that early in their life. But toddlers, when they're up and running around and they're up and about, there are several things you can do to help your child. Consider things like prunes or apricots or plums or high fiber kinds of diets, things like peas and broccoli. And you have those little bottles of things little jars that you can buy and give them this food that actually will help sort of bulk up their stool. Now, raisins are something that you may want to be a little careful with. Remember that small things that you give your child as food can sometimes go down the wrong tube, and raisins are probably not a real great idea. You're probably better off sticking with something that is bigger or something that's pureed, something that you actually feed them out of a jar that will help kind of bulk them up. Bread products, that side, so they can actually chomp on that. You want to cut back on things that tend to constipate children, and that's things like processed foods, rices. Bananas do. Bananas will basically stop you up some. Some cereals and breads will do this, particularly, again, the highly processed types. And fluids. The more fluid you have, the easier it is to have that hard, dry stool just become not so dry. So consider increasing your child's fluid intake as well. And if you have any concerns whatsoever, please get on the phone. Call your pediatrician. Get some information, because sometimes it's just a matter of understanding that that's maybe certain times and things are normal. If you change their diets, things may be any concerns, just get your concerns answered, no matter what your question is with your new child.
And one juice that kids really like is white grape juice, and that works really well for constipation. Another thing to keep a child from getting constipated is to really increase the fiber in their diet. For littler kids, for toddlers, for babies, once they're on solid foods, just chewing on some bran flakes, some of that good cereal that has a high amount of fiber in it, is a good way to prevent kids from getting constipated. And once they're over the age of about 3, you can introduce popcorn. It's a great way. Kids love it, and it really can prevent some constipation episodes in the future.